Hi, it's Dr. Dane Treat, and once again I'm coming to you from the American Medical Society in Sports Medicine annual conference in Atlanta, Georgia. And today I've got a really special guest. He is my mentor. He's who I trained with at University of Missouri at Columbia just a few years ago, Dr. Jim Kinderneck. Dr. Kinderneck is now at the Hospital for Special Surgery in New York, and he is the director there of the Primary Care Sports Medicine Fellowship. And today, for all of the runners that are watching or listening to this, I wanted to ask him some questions that centered around new runners, less experienced runners.
With any kind of training program, whether you're going to go weight lift, whether you're going to go run, you need to build up because the body is a living structure responding to the loads that are being placed on it. So if you overload it without opportunities for recovery, that's when you get hurt. It's not that getting some coaching is better. And unfortunately, some of those people come in after they've been hurt, and then they regroup to say, okay, let's do this a little better way. People lose sight of is how much recovery is a part of training. So if you're giving somebody a weightlifting program, you don't tell them to go lift 6 days a week.
Right.
First of all, they won't get stronger.
Right.
Second of all, they'll get hurt. So most of the training programs should be in the neighborhood of 4 days a week. Sometimes as you progress more into 5, but that's going to be variable. And then, that whole concept is making sure recovery is part of training.
Okay.
I always say one of the groups that always is prone to injury, swimmers, especially high-level swimmers that now decide they want to run. Because cardiovascularly, they're great, but they don't have the muscle bone strength that applies to the running. So they oftentimes, where most of us, our rate-limiting step is our heart and lungs, these people launch into it. Their heart and lungs is not the rate-limiting step. Then we'll see them with stress fractures and different things. I think the built-in information centers are these running clubs. They're very informative. Typically, people can get great information. Scary part is sending them to the web. They can get great information, but as we all know, you can get some really crazy information.